So when I meet a patient who's been newly diagnosed with kidney cancer, I typically walk them through the various generations of therapy that are available for the disease. In the 1980s, we were really limited in terms of our treatment options, and all that we had was traditional chemotherapy, the same type of chemotherapy that might be offered for breast cancer, prostate cancer, or what have you. In the 1990s, we moved into the domain of immune-based therapies such as interleukin-2 and interferon, and you can hear some of my comments on interleukin-2 in some of our other blog posts on this website. And finally, from 2005 onwards, we've had virtually every year the new approval of a targeted agent for kidney cancer. These are agents that really hone in on the specific mechanism of the kidney cancer, as opposed to chemotherapy, which really indiscriminately hits all actively replicating cancer cells. With all this being said, there are a couple of cases where I still use chemotherapy for kidney cancer. Now, one particular type of kidney cancer that I'll still use chemotherapy for is a rare variant called sarcomatoid kidney cancer. It's been estimated that sarcomatoid kidney cancer represents about 10 to 15% of all kidney cancers. And it's important to keep in mind that sarcomatoid kidney cancer really exists as a component of the other typical varieties of kidney cancer, such as clear cell. So you may have clear cell kidney cancer combined with sarcomatoid features, in addition to papillary kidney cancer combined with these sarcomatoid features and so on. Now, sarcomatoid kidney cancer tends to be a more immature type of kidney cancer. It doesn't have these mechanisms that are really intrinsic to our standard run-of-the-mill kidney cancer that might respond to targeted therapies. And by virtue of that, I find that sarcomatoid kidney cancer may frequently respond to traditional chemotherapy. So that's one of the few settings in which I may still use chemotherapy for kidney cancer. The other setting in which I'll use chemotherapy for kidney cancer is in cases in which patients have been exposed to all previous lines of targeted therapy. Now, with 7 targeted agents out there, certainly it takes a while for patients to come to this point. Having said that, I have a fairly large practice, and as such, I've seen patients who have been exposed to every single agent that's been out there as far as targeted therapies go for kidney cancer, and in those scenarios, sometimes we'll fall back to chemotherapy. What I'm really happy to note is in the few cases in which I've done that, we've managed to evoke some really outstanding responses. So I still want those of you out there who have been through those targeted therapeutic agents to have some hope if chemotherapy is put on the table for you. Now, one thing that I want to sort of separate from a traditional diagnosis of kidney cancer is a diagnosis of what's called upper tract urothelial cancer. This is something that really is a bladder cancer that's migrated up to the kidneys and perhaps vice versa. Now, this is a type of cancer that typically responds only to chemotherapy. We don't use the traditional agents for kidney cancer, the targeted therapies in that particular context. So that's the type of cancer that we may still consider traditional chemotherapy for.